what's the main age range target of the anti-tobacco campaign that you guys are implementing right now, and how much is the campaign costing in total for the FDA and any of the related agencies that might be helping out with the campaign?
Sure. We're trying to target LGBT young adults, so we're framing that as 18 to 24-year-olds. And this free life cost approximately $36 million, and it's important to note that these are funded by FDA's user fees that are collected from the tobacco industry and not taxpayer dollars.
Okay, great. Thanks for clarifying that. And also, two other questions. The What's the status of the regulatory authority that the FDA is seeking over the electronic cigarettes? And what's the rationale for the FDA having authority in that space, in that area?
The status is we're very close to completing the so-called deeming rulemaking, where we would, through the rulemaking process, declare that other categories of tobacco products that meet the statutory definition of a tobacco product are within our regulatory reach. We issued a proposed rule in April of 2014, and we are very close to being able to complete that final rule, which would include e-cigarettes. What was the other part of your question?
And I was just wondering also if you needed any authority from Congress, congressional authority in any of those areas in terms of regulation on e-cigarettes.
No. What Congress wrote into the Family Smoking Prevention and Tobacco Control Act when it was passed in 2009 was a provision that says the agency, through the rulemaking process, where first we publish a proposed rule and then ask for comment from all interested parties, and then spend whatever time is necessary to review the comments and then revisit whatever it was that had been proposed prior to issuing the final rule, and that's what we call the rulemaking process, that as long as we do that, we have the authority through rulemaking to reach e-cigarettes, hookah, cigars, and pipe, which is what we're doing when we finally complete the deeming